Okay, okay, now we're gonna start. So first, uh, I will restate the problem in plain words. I have a 1 month old who already have a respiratory illness. Then suddenly the baby becomes cyanotic, has stiffening, and eye rolls are deviate. And happen after feeding. That means the baby had an episode of sudden hypoxia or another neurologic event. So my job is to explain what mechanism can make a baby suddenly stop breathing or become hypoxic, and which are most likely in this situation. The big principle is that in infants, the final common pathway is hypoxia. I reminded myself in infants, lots of different disease look the same at the end. The baby may become hypoxic, then get cyanotic, then may have abnormal movements like that look like seizure and may become limp or stiff. So I wouldn't assume it's epilepsy right away because hypoxia itself can cause seizure-like posturing. So I organized into the ABC framework: A, airway; B, breathing; C, circulation; and D, disability, neurology, and metabolic. And I always start with what is most common and most dangerous. So the most likely bucket first: breathing problem from RSV bronchiolitis. RSV bronchiolitis is a lower airway disease. In older baby, it causes wheezing, but in very young infants, uh, it can cause apnea. So here's the key idea. RSV will inflame small airway, and the baby will tires out. The baby have immature respiratory control, so they can just pause breathing. If they pause for long enough, the oxygen will drop, and which convert into cyanosis, and the brain will become hypoxic. The baby have stiffening or eye deviation. So the episode can be RSV, apnea, hypoxia, seizure like stiffening. So while this is so high yield, you can think of in young age children with RSV and certain diagnosis, we would probably think of apnea first. So the after feeding clue, what does is the feeding trigger? When I hear worsen after feeding, I would think right away how real feeding can cause airway events. I ask what airway events happen after feeding. First, like we all know, aspiration, the milk goes into the airway or lungs. Two, choking, the airway obstruction. Hmm. Three, maybe the reflux with laryngospasm. The acid or milk triggers the vocal cords to close, or maybe less likely in a foreign body because a 1 month old usually can't grab objects, but choking on milk is real. So I would say it clearly feeding is a trigger. Trigger can cause airway protection fails and which eventually become hypoxia. How would aspiration look like? Most of the time, it will look like a coughing, gagging, wet sounds, increased work of breath in after feeds, may worsen gradually over hours or abruptly with big aspiration. And how would laryngospasm look like? It will have a abrupt episode, just like silent trip struggle, diagnosis, then recovery. So in the real case, I keep aspiration and laryngospasm high on my list because the timing fits. The next critical emergency to rule out is pneumothorax, especially if the patient is having a CPAP or PPV, positive pressure ventilation. Now, I think if the infant receives positive pressure ventilation or CPAP, it increases risk of air leak. A pneumothorax can cause a sudden desaturation, sudden increased distress, possible bradycardia, unequal breath sound. If unequal breath sound, and if tension pneumothorax, eventually cause shock or severe hypoxia quickly. So I would tell myself, sudden is deterioration, deterioration in this respiratory patient on pressure support, always consider pneumothorax. This is a don't mix diagnosis. So continue about circulation. Could the baby be in shock or have myocarditis? Now I shift to what if the main issue isn't the lung, but the pump? Infant with myocarditis can crash quickly with poor feeding, lethargy, tachycardia out of proportion to fever, hepatomegaly, signs of poor perfusion. If the heart fails, the lung will get congested, oxygen and the oxygen level will drop, which leads to cyanosis and collapse. So I asked, was there persistent tachycardia, poor perfusion, delayed cap refill, poor extremities, hepatomegaly, low blood pressure? If yes, I consider myocarditis or sepsis shock. So high yield knowledge, viral infection can cause myocarditis, and in very young infants, sepsis can present with fever. So next will be disability, neurology. Is this a true seizure from CNS infection or bleeding? Next, I ask, what if the stiffening and eye deviation was a real seizure? In 1 month, seizures are often not idiopathic epilepsies. They are usually secondary to something. First, infection, like meningitis or encephalitis. Second, metabolic disturbance like glucose, sodium, or calcium. Third is intracranial hemorrhage. Fourth is structural brain problem. So I will looking for some supporting clues. Like does the baby have some Burgin fontanelle? Is the baby irritability, 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 lethargy, poor feeding before the event, abnormal tone between episodes, so even without fever, neonates can have meningitis. So if I'm worried, I consider a lumbar puncture after stabilizing. So about the intracranial hemorrhage and vitamin K deficiency bleeding, if the baby is from an area with uncertain vitamin K prophylaxis, a home birth, poor access, vitamin K deficiency bleeding can cause intracranial hemorrhage, and it can present with seizures, lethargy, pallor, sometimes with no fever. So it's fair to consider head ultrasound or CT if the suspicion is high. Metabolic So in terms of metabolic, we always check the three quick killer is glucose, sodium, and calcium because these are common, fast, and treatable. So linking to the bronchiolitis due to RSV and we have a hyponatremia, if we properly trigger SIADH and the syndrome, and the body will retain water and the sodium will drop. If the sodium drop a lot, the brain will swell, and it will cause seizure, altered mental status, and apnea. So the chain is RSV, SADH, hyponatremia, seizure, apnea, cyanosis. That's why sodium and glucose is a must check. About hypocalcemia, well, calcium can cause tetany and stiffening. It can look like seizure. In a seizure infants, glucose, sodium, and calcium are not optional. How about anaphylaxis or medication reaction? Possible, but least evident. So could this be an allergic reaction to antibiotic or something injected? Anaphylaxis usually give some skin findings like hives, flushing, urticaria, swelling, and the baby will have squeezing, stridor, and potential. So in infant, it can be severe, but if there's no rash and no shock, it becomes less likely. Still, because timing could match medication exposure, I give it a possibility, but just not the top one unless science is positive. How about pertussis? Why I would test it. Pertussis in young infant can present with apnea, cyanosis, minimal fever, coughing may be absent early. It can also cause complications like pulmonary hypertension. If an infant have apnea cyanosis episode, especially with respiratory symptoms, it is reasonable to test with pertussis PCR. Even with if RSV is positive, it can be co-infection. So I'll put it in all together. My priority differentiate for this baby is first, my most likely and most consistent is number one, RSV bronchiolitis causing apnea and hypoxia. Second, feeding trigger aspiration or reflux laryngospasm on top of bronchiolitis. Must not miss would be pneumothorax, especially if CPAP or positive pressure ventilation. We could look for septic and shock, even because in infants they can be afebrile. Also important is hyponatremia in SEADH syndrome, hypoglycemia, hypocalcemia, CNS infection like meningitis or encephalitis, intracranial hemorrhage, vitamin K deficiency bleeding, maybe myocarditis or pertussis. So, so if I had to teach someone with no medical background, I'd say this baby have a lung virus that can make tiny babies forget to breathe. After feeding, milk can accidentally go the wrong way or trigger the throat to shut down, making breathing stop briefly. And when the oxygen drop, the brain can misfire and the body can stiffen and eyes can roll. We also have to make sure the lung didn't pop from breathing support and that blood stops sugar and consume are not normal because those can also cause seizure. Yeah, that's all.